So Lori Casselman is the CEO and founder at June Health. She is a seasoned healthcare executive with deep experience in employee benefits and health tech. At Sun Life, she led health services, scaling wellness programs, and earning the CEO Award of Excellence. As Chief Health Officer at League, she drove $40 million in contract value and built brand presence across North America. She later served as president and CRO at Wello, which was acquired by Maple. At Tribal Scale, leading growth in M&A, and most recently led TELUS Health's Global Consumer Health Division. A frequent speaker at many events around the Toronto community, Lori is now focused on transforming the women's health and menopause experience through June Health. Lori holds a Master of Science and an Honor Bachelor of Science at Western University, where she was also a varsity rower. Please give it up for Lori Casselman.
Thank you so much, Amar. I feel like I'm at a point where we shouldn't talk about what I did in university. That said, really appreciate the introduction. So thank you. It's great to be here with you tonight. I think you're going to notice a lot of themes in terms of the presentation that I've put together to talk a little bit about my founder journey and the building of June Health. Admittedly, I'm 2 years into my founder journey, so I feel like I'm sort of a novice in sharing lessons learned, from a founder. I will say, though, one of the key things, and I heard it from one of the previous speakers, really this journey for me began, I would say, somewhat uniquely. So as Amar shared, my career has been on, sort of a corporate path, working in larger organizations. And I've worked in a couple of earlier stage health tech startups. Never imagined I would get to a point where I would found my own company. So this was definitely a little bit of like a shocking discovery. And it came for a couple of reasons. I would say the first, and I call it the perfect storm. So it's a little bit of your trifecta that you shared. I had a personal experience as I was going into my 40s, and it was really entering the stage of life that is midlife and perimenopause. And I have to say, even as someone who has 20 years of healthcare background, the whole thing just took me by surprise, right? I really wasn't expecting this like cascading sequence of symptoms that seemed to be appearing every kind of 6 to 12 months, new things. Couldn't sleep, hot flashes, night sweats, all kinds of interesting things happening within my body. And I'm busy, I'm a busy working mom, I've got a busy job, all of these things. So I'm really not taking the time, other than probably once a year when I'm going for my annual checkup, to figure out, what's really happening here and how do I get a handle on it. And so the first piece of, the motivation here was my personal experience. What I realized really quickly when I started to share this with friends, family, colleagues, a little bit of the, hey, are you experiencing any of this? I realized I was not remotely alone, and so many women are caught off guard as they enter their 40s and in some cases 50s and start to go through this stage. And so this was the first piece of that sort of perfect storm, right? It was that personal experience combined with my professional experience, and then also a deep, deep dive into the market and the opportunity that existed within the market. What I realized, this journey is on average 7 to 10 years for most women. Begins sometimes in your late 30s, early 40s. There's all kinds of opportunity, I believe, for employers. If you think about this as, employee benefits strategies within organizations, which is really where I've spent most of my career, they're built to be inclusive. They're built to support the health needs of an entire population within an organization. And yet most have some pretty significant gaps as it relates to women's health, fertility and family planning, perimenopause and menopause. And so, for me, I just identified there's this really interesting gap that is starting to be filled in other markets and really hasn't been filled, I would say, significantly here in Canada. So it was a bit of an opportunity met passion and interest for me. Then what we did is, again, I think I had to convince myself a little bit that this would be a smart thing to do at this point in my life and career. to really dive in and start a company, found a company, right? This would be new territory for me. And so I did the deep dive customer listening. I did close to 100 interviews with buyers, people in my network that were in the insurance space or plan administrators, brokers, advisors, really those folks that would become our distribution channel if we were to launch this service. I really wanted to understand if we built a product in this space, would employers subsidize this product as part of an employee benefit strategy? And then we spoke to over 40 patient members to really understand, okay, what kind of care are you looking for, right? What are your needs? And we heard a number of things. I would say the first was convenience. I don't have time to go to many different appointments and try and find a provider that understands these needs and can directly address my symptoms and provide a care plan. If I could just get to that person much more conveniently, it would be a dream come true, right? And to get a care plan early versus going through this cascading many years or sequence of symptoms, that's a pretty significant challenge. Convenience, again, I think led us to this notion of, this business needs to be entirely virtual. Over 90% of these symptoms can actually be addressed in a virtual environment. So that presented a really interesting opportunity for us as we thought about our business model as well. And then I would say the last piece that we heard repeatedly from members is the more convenient you can make this end-to-end journey for me, or let's say I need to meet with multiple practitioners, or I need to access a prescription or supplements, the better. And so then we started to bring our team together, and I was very fortunate to have some pretty incredible women in my network, equally passionate about this space and solving this problem, join me on this mission of building June. And so what you see here is just a little bit of an example of our care journey. So what we were able to do, and I'm going to be conscious of time and not provide, all of the details of the care journey, but what I will say is it was incredibly validating to take what was my 7-year journey, and in our first MVP and alpha trial, we were able to turn that journey into 5 days. 5 days including you have a prescription and it is delivered to your door within 24 hours, covered by your benefits. So that was definitely a very, fulfilling moment for us, I will say. In terms of the road ahead, we have big aspirations. It's one of the things I really want to encourage, fellow entrepreneurs, female founders in particular, think big, think bigger, right? Often, I talk to women who are entering these journeys and, there's a little bit of imposter syndrome. And I will say, certainly, I am someone who had a little bit of that initially as well. But as we got that validation, we just continued to think bigger and bigger. And our vision is to be the premier destination for women's health support, servicing needs across many stages of a women's health journey, and becoming part of an inclusive employee benefit strategy in all of the top organizations. So we're starting in Canada with plans to expand. We started with perimenopause and menopause. We've already expanded into weight management, women's mental health, general health conditions, and much more to come. And so I am excited to share June Health.
Midlife changes everything. You're doing it all, balancing career, family, home, aging parents. Your health needs aren't simple.
I could almost voice over at this point. I've heard it enough.
And when you do seek care, it's confusing, fragmented, and hard to access. That's why we built June. Forget unrealistic checklists and generic wellness apps. June delivers proactive, personalized care from women's health experts across physical and mental health, all working together around you.
I got an initial consultation, a clear diagnosis, my prescription delivered to my door, and a follow-up all within 5 days. June has been a huge time saver and a massive relief.
Employers, this health need is real and it matters. Every unaddressed symptom hits your bottom line. But with June, higher retention, better performance, healthier teams. We lighten the load for HR too. No wait lists, no guesswork, just expert care, easy access, and real-time support. June isn't just a benefit. It's a commitment to women, to well-being, to what's possible.
Thank you, Lori. That was great. Thank you so much. What a great story and what a great business. I was going to say, I think Vijesh was talking about like the addressable market, and I guess, Lori, you would say, any females in the room? Because there's your addressable market. Great job. Thank you. Any questions? We might got time for like one or two.
So your business model is not direct to consumer. It's through insurers and employers. Is that correct?
That's correct, but I will say we actually made a decision in principle once we knew we had built something really special to open it up to consumers as well. So you can go onto our website and just purchase a membership and get access to the platform as an individual consumer.
Okay. I'm asking because I know that with the sort of the market right now, with employers having, the leg up and not having to worry so much about recruitment or retention, does that affect your, sales goals or plans in terms of going to that market?
It doesn't, and I will say, we have had some great early success. Listen, we've got a long path ahead of us, and so I wouldn't count our chickens before they're all hatched necessarily, but so far the signals have been really positive. We did one thing that I think is a very important distinction in our business model and how we price, and this was based on a lot of that customer listening. What happens often in this space is providers blend the platform fee as well as all of the appointment fees into one contract fee at the employer level. We disconnected the two. So basically the employer is just covering the cost of the platform, which is the point of entry for all of their members. And then we work directly with every individual that comes onto the platform so that it's personalized. They can choose their care journey, the practitioners that they're meeting with, and we help them to understand how to leverage their benefits, so private insurance, public insurance where it applies, and then we surface really transparently where something's going to be an out-of-pocket pay for them, so that they can, make a conscious decision before they proceed with any of the services.
Okay, thank you.
You're welcome.
One more. I think we got one right here. Here, I'll just give you this mic.
Hi, so with something like healthcare, there's a lot of moving pieces. There's the patient, there's doctors, there's hospitals, employers, insurance. My question is, how have you, over time, designed your approach in terms of breaking into the market, and how has the journey been like?
Great question. So I would say we are very purpose-built for working with employers as part of a benefit strategy, and I would say that's an important lesson and piece of advice too, is just really know what your go-to-market strategy is and who your product is focused on. Because we knew we wanted to be B2B, but have a B2B to C element in our model as well, it impacted, how we structured our pricing. It's impacted how we built our marketing team and our go-to-market strategy. And so that's really our core focus, right? From a buyer perspective, from a user perspective, it's the employee, right? Or the member on our platform. We're very conscious that we have a third audience and key stakeholder, which is our practitioners. And so whether it's in our product roadmap or how we think about marketing, many aspects of our business consider all three stakeholders with a lot of focus on each and their needs.
Great. I think that's all the time we got. So thank you, Lori. Again, give it up for Lori.